Yeah, but I don't think octopus was what we wanted to talk about
No,
today.
no.
But it
So
would probably make for an interesting podcast.
it would.
Well, unless you're doing hernia surgery on the octopus, but
Right.
not the
I
no.
don't. That would be hard. I don't know if octopus can get hernia.
Dr. Jeffrey Blatnik is an associate professor of surgery at Washington University School of Medicine in St. Louis. He earned his medical degree at Case Western Reserve University in Cleveland, Ohio. He went on to complete a general surgery residence and then minimally invasive surgery fellowship at Case Western Reserve University. He finished his training and joined the faculty at Washington University in August of 2015. His surgical practice at Washington University and Barnes Jewish Hospital focuses on the care of complex hernia patients, including robotic, laparoscopic, and open methods of repair. He serves as the director of the Washington University Hernia Center, and Dr. Blatnik's research focuses on the improvement of hernia repair methods and devices, along with the evaluation of patient outcomes and improving the patient experience. Dr. Blatnik, Jeffrey, can we call you Jeff?
Jeff is great.
Jeff, welcome to the show.
Thanks for having me. I'm really excited to be here.
Awesome.
Amazing.
Actually, maybe to kick things off, Jeff, we actually met you, I think, first at Sages a number of years ago. How did that go this year? Did you end up going, and how did they make that work?
I actually did not go to Sages. So I have 3 young kids that all are not old enough to be vaccinated yet. And I had an exposure this summer from a vaccinated person. And so spent 10 days in my basement isolating from my family, and decided that it just can't put that extra risk at my kids until they can be vaccinated. So I'm taking a break from the fall meeting cycle, and then hopefully by next spring, we'll be able to get back into the swing of things.
Fair enough. It's too bad though. I think I read it was in Vegas this year. I don't know if that would have been a big draw. So
yeah, Vegas is good for about a couple days, at least for me, and then I'm usually ready to move on to something else. But I heard it was despite all the challenges with the pandemic, was a really successful meeting, and everybody who was able to make it, really enjoyed the time and thought it was very educational.
Yeah. And what I remember actually from Sages and yourself, Jeff, was that you were very involved in quality, always attending these meetings to present on different topics and to share knowledge from your practice. And kind of speaking on that, you are really a leader in hernia repair surgical quality, and have such an immense focus on improving quality across the board. Just 2 examples that I've pulled. One, you're the chair of the mesh labeling task force of the America's Hernia Society. And then also WashU's participation with the AHSQC, the National Quality Collaborative. Where did that passion for improving surgical quality come from?
I mean, I think at the end of the day, we're all in it for the same reasons, or at least we like to think we are, right? We want to do the best thing for our patients, give them the best quality of care that we can. And specifically in hernia world, a victory or a success isn't necessarily recognized a month after the operation, and really requires more long-term follow-up. And the challenge with hernias is they fall into a whole spectrum from, something really little that takes 45 minutes and you put a couple stitches in and the patient's fine, to some very significant and life-altering, challenges and problems that patients come to the office with. And it's finding a way to treat both of those patients to the best of our ability, and making sure that we can follow them along and they have a good outcome. And provide the best care that we can across the whole spectrum.
Mm-hmm. And I remember, like, for myself personally, before getting into more of the health tech, patient engagement stuff, I was really into quality and safety as well. And for me, a big motivator was having a fantastic mentor who was very involved in readmissions prevention, and he kind of shared that passion to myself. Just wondering, are there a couple of specific mentors who have played a particularly critical role in your work in surgical quality?
I think it comes along from the beginning. I mean, my interest in hernia specifically kind of came from some of my time training with Michael Rosen, and then Yuri Novitsky and Ajita Prabhu, who are all, kind of leaders in the world of hernia repair, and certainly learning from them as far as not just the techniques for fixing these problems, but also, how to care for the patient, from the beginning to the end, I think was really valuable, and kind of realizing that what we do is much more than just being a technician and patching holes for people, but really providing, care along the whole spectrum.
And so you've actually alluded to the fact, hernia repair is one of the most common surgeries that can happen. And given the evidence for outcome improvements with different models of care, like enhanced recovery after hernia repair, that's become pretty popular. I think it's very interesting to point to the fact that you were one of the first to leverage digital patient engagement or patient engagement technology for hernia surgery patients. What motivated you to bring digital care to your patients in the first place?
So I think one of the first things, it sounds kind of simple, but we realized as patients were getting the surgery and then they go on their way, we kind of give them a piece of paper and say, here's your instructions and kind of good luck. Or we talk to them in the office even before surgery and say, here's what your operation is, here's what you can expect. But meanwhile, patients aren't comprehending everything. They're not able to process all the information because it's a tremendous amount of data and specifics that we give them. And so you'd see patients both before and after surgery, and it's like, they forgot a lot of the core details about their recovery and what to expect. And then, when they go home, we're not there following them all the time. And we realize that little things can happen here and there. Patients can have questions and a 5 o'clock on a Friday evening, 2 o'clock on a Sunday morning, which may be very simple, but they'd like to have the answer to that we can't necessarily do in old manners or old styles of handing you some discharge instructions and hoping that answers all of your questions. And so it was realizing that we were behind the times in giving the patients all the information that they want. We're so used to getting on our phones and, you have an argument about what year this movie came out, right? And you right away could look it up on Google and know that, this movie came out in 1987 and you solved the argument or you answered your question right away. And we didn't have that available for our patients. And this made the most sense for me as a way of providing, the type of immediate answers and engagement that patients ultimately want to have. But what I think provides for better care, from the minute we first meet them in the office, through their operation, through their immediate post-op period, and then ultimately long-term as well.
So, obviously education is a huge part of what digital patient engagement is, providing the education, recommending care for patients based on their input. It's a pretty, comprehensive program that you've built for patients. And so it is still relatively new, this idea of digital patient engagement. How would you describe what SeamlessMD is to somebody who's new?
Yeah, so I think you described it what it is. And the way I tell it to patients when I first meet them and describe to it what SeamlessMD is and why we use it, I tell them that this is a way for us to stay engaged with the patients when they're not in the hospital or when they're at home. I tell them that, the learning library that you mentioned and the educational component is a huge part of what it provides. And again, that goes back to that concept that at that first visit, patients don't appreciate everything that we say or know what questions to ask and want to come back and look at it again later. So I think it not only provides that information, but I also find it very helpful for the patients who go home after surgery, who have a question, is this normal for my wound to look like this, or is it unexpected for me to have a cough, or man, I have a fever, what should I do? And like the daily health check-ins and all those things that we built into our version of Seamless, not only gives some reassurance to the patients for things like, okay, this is normal, I don't need to worry about it, but it does the very opposite of saying like, hey, this is something we're concerned about. We want to know about it, call us here. And then, at the same time, our nurses get those triggers to say, Mr. Smith just filled in that he was having a fever and his wound looked red. And then our office staff use that to hopefully, connect with the patient sooner than the patients who sit at home and, come in 2 weeks later and said, oh, it's looked like this for, 10 days now, and I didn't know something was wrong. So I find it incredibly valuable on those fronts.
And, we've seen a lot of adoption of this kind of, alerts and remote monitoring of patients, since the pandemic started. But, Jeff, you were kind of more of an early adopter. You and your team were using this before the pandemic. I was wondering, since the pandemic has happened, like, has that changed how much you're doing this sort of like remote monitoring with your frontline staff? Is it about the same because you're doing it a lot anyways? Is it more than before?
I think it's probably a little bit more than before, and not so much that we're doing anything differently, but I think patients have now come to realize like this is the way care can be provided. We're also used to doing things on Zoom, and we're used to doing things virtually. Whereas historically, a lot of people, had to come to the office. There wasn't another option for them to get care, whether it's from a built-in learning library or from direct, outreach to providers and their support staff. So I think we're doing a little bit more, but not that we're driving it, but that patients have come to expect it and adopt it as part of the care that they can receive.
Mm-hmm.
And actually, on that note, since more and more folks are going digital and virtual for, let's say, their pre and post-operative follow-up, I was wondering, are you seeing, whether it's at WashU and other places, are you seeing more centers of excellence, I guess, have more patients who are willing to maybe travel from far for kind of your specialty care, knowing that at least there are more digital ways to stay connected?
Yeah, I mean, I think that comes down to a couple of things. I mean, one is, people are more engaged electronically. And so, the days of their primary care just saying, hey, go see Dr. Jones for your surgery, patients are much more independently driven to find the best care and stuff that they want. And so being able to offer an engagement platform that helps us communicate with the patients and keep track of them, certainly meets into some of the needs of things that they want. So I think having it available is just another resource that we can offer to patients, especially, and we're pretty unique here in St. Louis in that we have a huge catchment area where people do frequently drive 2, 3, 4 hours, if not more, to come get their care here. And so by being able to minimize the number of post-operative visits, make it easier for them to assess how they're doing, is certainly helpful for patients.
Mm-hmm. You're also collecting a lot of patient-reported outcomes on the platform. So, Hercules as one, and the Carolinas Comfort Scale, I believe it's pronounced Hercules.
Yep,
I've only read it. I've never actually heard it. Why do you believe that collecting PROs is so important?
I think it's just another part of the whole care spectrum. And for us, part of the reason we're doing it is an adjunct to some studies looking at how different techniques ultimately impact their PROs. And so that's one of the data points that we're collecting, because how the patient's perception of how they're recovering and how they're doing is just as important as how their wound heals and that sort of stuff. And since it's part of a study, and being able to link it all in with Seamless for us has been really helpful, because now not only do we get the benefit of collecting the PROs for our research projects, but as patients participate, they also get the benefit of access to the learning library and the engagement processes that they can do at home. And a lot of patients report, they feel like we're keeping an eye on it. We know what's going on, which is, it's important for patients who are always worried about how they're recovering.
The past couple of years, we've seen kind of PROs play a bigger role in kind of new payment models. So, I mean, probably most commonly for hips and knees, with CMS, their bundles now where you have to report PROs back to CMS. Do you think that's going to happen in the hernia world at some point in the future?
I mean, I'm sure it'll be a component of it, whether it's, the end all factor that weighs into things. I mean, there's certainly a lot of other issues at play, but I think things are going in that direction. And I think we have to engage that, what the patient is experiencing and how they're recovering is just as critical as any other variable that we can collect along the way.
Mm-hmm. Yeah, absolutely. So one thing that is unique, and we've already talked a little bit about the remote monitoring capabilities, but I know your team in particular does use it quite frequently. So you're catching a lot of alerts, and especially early days, you were wanting to really figure out what's going on with the patient once they've left the hospital at every kind of check-in point. How does your care team actually use the technology to monitor patients? Do you have kind of like a breakdown of how that works?
Yeah, I mean, so we've seen, especially in the big complex hernias, that the biggest area of concern is that first kind of couple weeks when they're at home, and the risk for infection, usually tends to present itself in those couple weeks. And that when they leave the hospital on day 4 or 5, they're usually okay, but it's over those next 10 to 14 days where things start to present itself. And so one of the things we wanted to do was try to catch those issues before they become a major problem. And so that's where the daily health check-ins and all that sort of stuff in the early period we felt was really important. We have examples of what normal wounds look like, what abnormal wounds look like, so people know what to be on the lookout for. And then to your point, those triggers then come back to our office staff and our nurses, that if somebody does report, the findings that we deem to be concerning, not only does the patient, get a message that says, hey, we're worried about this, please call the office, but it also can come back to, or triggers to our nurses, and they can reach out to the patient directly as well.
Jeff, you're an early adopter of this. And so whenever you're bringing something new into an organization, whether it's enhanced recovery or digital patient engagement, it's a team approach, team effort. So you got to bring other folks in, get support, rally people. How did you, I guess, corral the hernia team to stand behind bring something new like this into the office?
Yeah, I think most people are on the same page, when we got started, and everybody, is trying to accomplish the same thing, right? We all want the best for our patients and to improve their outcomes. And to be honest, I think the way that things were set up, with you guys as partners is really what drove people's willingness to adopt it, as far as engaging all members of the team, from myself to our research coordinators, to our nurses, to even our inpatient nurse practitioners, along the whole spectrum. And so by getting everybody on board from the beginning, hearing what their input was, what was important to them for the patient's outcome, I think is really what was key to get everybody in support of bringing it on board.
I think you brought up a really great point. I mean, one of the things that we found is when the team has an opportunity to, I guess, review and weigh in on the content, the protocols that are delivered to patients, and it's not prescriptive. It's not like, hey, here's the content, you have to use it, you can't change it, but your team could customize it and put your own vision to it. I think we found it gives folks a lot of ownership on the program. It truly is yours. Yeah. And it matches what you're telling patients. I think what we found is if that wasn't the case, then it's hard for teams to be bought in. So I think that's a wonderful point.
I think along the same lines, I'm not the one that usually takes the first phone call from the patients, whether it's pre-surgery or whether it's somebody who just had surgery. And so having the office staff or the people who take that first line phone call weigh in, they may get a question 9 times out of 10 about, what to do with their staples. Mm-hmm. And I wouldn't even think that would be a common source, because it doesn't usually make it to me. So mm-hmm. I think, having people from the frontline office staff to, everybody is really key to get their input and all that sort of stuff.
Yeah, absolutely. Jeff, I know we talked about it a little bit at the top of the podcast, but you've shared in the past on how mentorship was really kind of your guiding light to become a surgeon in the first place. And I think it's quite interesting. You've now carried that torch. You've won the resident teaching award multiple times back when you were doing your residency. Curious to know why you feel like having mentors and being a mentor for others is so important.
I mean, that goes all along, from medical students and residents to junior faculty and everybody like that, in that we all need, somebody to help at least point us in the right direction. And that's how we continue to grow. And to be honest, like, as somebody who went from being a mentee and still I'm ultimately a mentee, right, where you rely on people to help guide us even as we get further along our experience, you learn and gain new understandings of challenges and all that sort of stuff. But now as a mentor for a lot of, again, residents, junior faculty, all that sort of stuff, I mean, not only is there kind of the emotional satisfaction of watching people who you've helped become successful in and of themselves, but it pushes you to be, more open to new ideas and trying new concepts and all that sort of stuff. So I think it pays off, on both sides of things, being a mentor and a mentee, for sure.
So question, just shifting gears a little bit, now that the US is opening up, what aspects of patient communication do you think virtual has completely replaced? And what do you think would most likely still go back to face-to-face?
I mean, I think to be honest, there's still something to be said about sitting there with a patient and talking to them, and it builds a relationship. I mean, Zoom is and whatever digital platform, are great endeavors that have facilitated our ability to do a lot of things that, 10 years ago, if this pandemic had hit us, we'd be in big trouble, right? I mean, we wouldn't be able to have meetings, we wouldn't be able to do all this stuff like we are nowadays. But there's still something to be said about meeting face to face. So I don't think that's ever going to go away. If anything, I miss the ability to shake hands routinely and all that sort of stuff and build that kind of personal relationship, with patients, even though it sounds simple, is a big part of it.
Yeah.
But at the end of the day, we're all becoming more reliant on, immediate, return, getting our questions answered right away. If I want to make a reservation for dinner and I think about it at 5 a.m. or 1 p.m. in the afternoon, like I want to just be able to go on my phone and make a reservation. And the same concept we used earlier of, answering what year that movie came out, you want to be able to do it when you want to. So I think it's just an adjunct to the what we have already, but certainly there's a lot of patients that don't need the extra challenges of coming to the office. If they're doing fine and we can check in on them, either remotely or via some of these things, and they're doing fine, that alleviates the extra frustration. They don't have to take time off of work to come to their appointment and different things like that, which for a lot of people is a tremendous improvement in what they need to do.
Mm-hmm.
And Jeff, on a similar note, but maybe from an academic lens, like I know for a lot of other industries, when the pandemic started and then a lot of groups had to go virtual for conferences and collaborations and all that, at least for a while, there's a lot more activity because it was so much easier to organize an online virtual event. And obviously in the surgical world, the in-person events are still a big thing, but I was just wondering, have you seen an increase in online meetings, collaborations academically, or really you need that in-person event at something like SAGES and you can't really recreate that online?
I think you can recreate a lot of the content virtually, as far as the educational component, the lectures, the access to talks and finding data and all that sort of stuff. I mean, that I think is pretty easy to replicate in a virtual pattern. Some of the networking and that sort of stuff, again, these digital platforms are good, but if you've ever tried to have a meet and greet with like 10 people on a Zoom or a Teams meeting, it's not that functional quite yet. So we're not quite there. So I think there's certainly aspects of it that, from an academic standpoint, that's not going to go away. And that's still important for the face-to-face, but a lot of the content that we used to deliver, whether it's, case proctoring or case observation and different technology like that, we can now do a lot of that remotely, and it saves people from being away from their family and traveling. And again, in the era of, still having the pandemic with us, unnecessary exposure to risks if you don't have to.
I think one of the things that I found is that even though some groups and societies have tried the hybrid, okay, we'll have the in-person event, but you can Zoom in if you want to. At least from the ones that I've been in, it's been difficult because when you're in, I mean, I'm sure you've experienced this too, Jeff, when you're in the room, you have more of a presence. It's easier to be heard. It's easier to get your question into the presenter. I felt when I was virtual, I was truly a bystander. I'm curious if you felt the same way, if you've had to live that in the past year, but I'm honestly not really sold on how the hybrid will work for some of these larger events. I think it'd be pretty tough.
Yeah, I mean, I think as a remote participant, you're much more of an observer than you are a participant, right? You can observe and get the same kind of content in that manner. But if it's important for you to be more engaged and active rather than just observing the meeting aspects, I think that's going to be hard to do virtually. And I think it's going to, still require us to be in person for the most part.
Yeah, definitely. And I can appreciate what you were saying about, disseminating learnings. And so here, sharing knowledge, that can be done instantly. Kind of going back to your movie example, like what year was that movie done? Can we share this, fairly instantly? That makes a lot of sense. But yeah, engaging with the actual presenters or the topic and really, being in the room does definitely make a difference. I'm curious, just kind of taking that same train of thought on virtual care, what are some of your major predictions on how virtual care in general might evolve over the next, let's say, 3 to 5 years?
Yeah, I mean, I think it's gonna stay with us and it's gonna get better and better. I think there's some challenges that need to get sorted out from a regulatory and government standpoint, especially for those of us who have a big referral, from outside resources. For example, for us in the States, I have to be independently licensed in each state where I'm going to see patients. So for me, I get even though I live in Missouri, we're right on the border of Illinois. So I carry a Missouri and an Illinois license. I get a lot of patients from Arkansas. So I'm going to get my license from Arkansas because the virtual thing is great for those patients who live far away, and to be able to provide them care without them driving 4, 6, 8 hours to come to the hospital. But I think there's certainly some of those challenges that need to get sorted out as far as, from a government and regulatory standpoint. But I think it's going to be around as technology improves. It's easier to do these sorts of things for patients. I think as, patients, as the consumer become more comfortable with these digital and virtual platforms, I think they're going to ask for it and expect it more and more. And I think as the population matures too, people are more comfortable doing these things virtually, whereas a lot of now of our more senior population, actually is pretty impressive now. The number of them can jump on Zooms and troubleshoot their technology. But obviously, the further into this we get, the more comfortable people are with using the technology to provide their care. There's some things you still, again, you need to see patients for, you still need to put your hands on them and get an idea what's going on. But I think it's going to stick with us for a long time.
Yeah, definitely agree. All right, so Jeff, we're actually going to shift gears to what we call the lightning round. It's basically 5 questions to get to know you a little bit better for our audience.
Sure.
The first question that we have is, what is your favorite book or book you've gifted the most?
Ooh, I think it really depends what kind of mood I'm in. I think I would say my favorite book I've read recently was actually all about the Thai cave rescue of that soccer team that got stuck in there. And so it kind of met some of my interest in like technical things because it was very technically described, yet it had some interest in, scuba diving and yet everything like that. So there was a good, I can't remember who wrote it. It was a couple years ago, but it just is one of those books that I read through it straight through because it kind of met all of my needs and interest along the way.
That's great. What was the book called? Do you know?
I can't remember, to be honest.
That's okay. We'll look it up because that does sound fantastic.
I can share it with you when I get into my Audible. I'll let you know.
Okay. It's also amazing to think that was years ago now, because that honestly doesn't feel like it was that long ago. But I guess, COVID and everything kind of just really,
we're going to start changing what BC means. Like BC is just going to be before COVID. And AC will be after COVID.
That's right. That's right.
Pretty convenient that C kind of fell through because it is now we all think about like when stuff was. We're like, well, was it before COVID or was it after COVID?
Yeah.
So
we're
just going to change BC. Like we've moved on, start from 0, and it's before COVID and after COVID.
That's great.
You heard it here first. Officially, we started this movement.
When it becomes popular, I want everybody to know this is where it started.
That's good.
It's recorded, Jeff. You get the credit. So.
Exactly. So question 2 actually fits really nicely in with your answer there. What is your favorite scuba destination?
Ooh, I think it depends what kind of mood you're in. Can I do 2?
Sure. Yeah.
All right. So I would say like the last couple places we dove was in Costa Rica on the Pacific coast, which is totally different from diving in like the Caribbean, where it's much more, it's not really a sterile environment, but it's very rocky. And huge amounts of wildlife, like giant schools of bait fish, and it's where tons of eels and sharks, and we saw a bunch of octopus and all sorts of stuff.
That's in Costa.
What's that? That's out of Costa Rica in the Pacific. But it's very different from if you dive in like Grand Cayman or Turks and Caicos, where everything is bright blue and there's tons of bright coral and bright fishes and all that sort of stuff. So they both have their unique side of things. That's really fun to look at.
Yeah, definitely. That's awesome. Question 3 that we have, what is something in healthcare you believe that others might find insane?
the amount of paperwork that we have to do. I think it's funny, nowadays you go talk to patients and you have to do paperwork on actual paper to say you did the computer paperwork in order to get them through to surgery. So the amount of paperwork that's required just to give patients the care that they need, and the regulatory requirements it's mind-boggling, and it's getting worse rather than better.
Right. And then faxing that paperwork as well.
Jeff, someone has to keep the paper and the fax machine business, going. I guess it's healthcare.
It's healthcare. It's not only is it fax machines, because we don't actually, it doesn't come out as a fax, but a lot of data is still shared as fax. The other one that's still amazing that I think healthcare is keeping alive is the compact disc industry.
Oh, wow.
At least in the States, we don't have a great way of sending imaging around. So when a patient gets a CT scan at an outside hospital and their provider says, oh, well, you got to go to WashU to get your hernia fixed, my office has to call. The other hospital or other institution will print their imaging onto a CD drive and then mail it. And then my institution will get that CD drive and upload it into the computer system. And so we're so antiquated, and like, who uses compact discs anymore? And it's slow and ineffective. So the next iteration of that will be like, people just put it on 1 gigabyte thumb drives. I mean, those things don't cost anything anymore, but then you're still mailing it. So I think if we need to invest in something, it's a good repository to share imaging electronically will be the next big thing. Some of the EMRs are good at sharing, notes and visits and that sort of stuff, but imaging is still not very good. So that would be the next thing that I think is still unbelievable, that yes, paper and then compact discs are still part of the care we give people.
So Jeff, that reminds me of this story. So here, I'm not going to name who, but there's a hospital here in Toronto where in the same building, in the same hospital, the primary care team is on a different EMR than the rest of the hospital. And so even though they're in the same building and they're technically part of the same healthcare organization, they're faxing the information between floors because they're just not on the same system. It's incredible. I can't believe it sometimes.
Yeah, I mean, EMRs and that part of it's a huge cost. And to be honest, if you look at some of the indirect costs for institutions, IT is probably number one. I mean, institutions probably spend more on their IT infrastructure than they do on keeping the lights on or the water running nowadays. And so, and it's vital to the care we provide patients in both good and bad ways. I mean, we've gotten very used to digital notifications and immediate results. And, I can pull up your chart on my phone. I can pull up your chart on my tablet. I can pull up your chart in the office. I can take pictures on my phone and it's immediately available in your chart so we can use it for reference later. So there are some great parts that the EMR has really facilitated our care to provide. But yeah, those types of scenarios where, somebody comes in and they're like, well, it's all in the computer. And they may be right. It may be in their primary care, for us who's just up the street, but that doesn't mean we have access to it necessarily. And so it's frustrating for sure.
Yeah.
Jeff, thank God for fax machines. That primary care clinic, they can fax you that information.
Fax it over. And then, like all good faxes, half the lines are kind of cut off and the text is all blurred together. And, they send you a copy of their endoscopy report and it's just a black square with like a little white dot in the middle. And you're like, well, that's clearly an abnormality.
That's great. All right. Question 4, would you rather have super strength, super speed, or the ability to read people's minds?
I don't think I'd want to read people's minds. So I'm going to take that one off right away. I don't think I'd want to do that. What would I use more often? Super speed or super strength? My biggest challenge right now is time. So what can I do to give myself more time would probably be speed. So I guess I'll take super speed to try and get some more time in the day so I can, not necessarily get more work done, but I have more time with my kids and my family and all that sort of stuff. So I'm going to pick super speed as my one from there.
Totally fair. Yeah.
If you got that, you would hold the world record for fastest surgeries done.
Yeah.
Yeah. I mean, especially like if that speed is not limited to just how fast you can move, then definitely there is value in having super speed for sure. I don't need to be that strong, but if I can go fast, that would save some time.
Yeah. head on over to Costa Rica on the weekend for your scuba, just run there.
Just jog down and then just jog on back. It'd be perfect.
All right, last question that we have, and this is a COVID-19 lockdown related question. What is one hobby or activity you've gotten into since the beginning of the pandemic, or since year zero in this case?
I don't know if I want to admit this. I started collecting bourbons. I think that's
cool.
I can't say I really drink that many of them, but we've gotten into the habit of collecting a bunch of them, which is fun. I would think if anything that's really important to us, with our kids being young and during the pandemic when you couldn't do a lot, we kind of started a weekly movie night, and everybody would vote in what they wanted to do, and we'd all kind of get together and watch a family movie together and kind of pick and choose what each person wanted to watch. And so everybody kind of looks forward to that Saturday night movie night for the family. So I would say that's more important than any bourbon collection or any of that sort of stuff.
Yeah, I was gonna say, so did you need the bourbon to put up with that, but no, it sounds like that was the more important.
Some movies it's helpful,
right?
Most of the time, otherwise it's okay.
Oh, that's awesome.
It depends who picks the movie, I guess.
Yeah.
I guess Jeff,
right. If it's the 5-year-old,
Jeff's pick, yeah.
I'll be honest, I don't have much of a say in what movie gets picked.
You only get one vote, apparently.
I get one vote, and it's not worth much. It's a fraction of a vote.
That's fantastic.
But the second takeaway from that is I also complain the least if my vote doesn't get picked, so it's much easier to go the other way of letting the kids pick.
Yeah, good call. Great call. Well, Jeff, thank you so much for coming on the podcast today. That's really all the questions that we had, but for sharing your insights on what you're doing with your hernia practice, and really for being a thought leader in this space on digital patient engagement and quality, and just sharing your wisdom of being a mentor with our audience, and hopefully there's a lot of insights that our audience can learn as well. I definitely learned a ton, so do want to just thank you for coming on the show today.
Well, I appreciate you guys having me. This has been a lot of fun to not only talk about, patient care and the nuances of that, but, life and other things that are important to people. So I do appreciate the invitation, and thanks for having me.
Thanks so much, Jeff.